Hi folks, I'm Dr. Ed Beyer. Today we're going to be talking about one of the main reasons why people develop an autoimmune disease, and that is a breakdown in the barrier between our outside world and the inside of our body. And many of us think, well, our skin is a barrier between the outside world and the inside of our body. If I cut my skin, I will have an increased chance for an immune reaction, infection, and things like that. But folks, our skin is not the largest barrier between the outside world and the inside of our body. It's the lining of our gut. We have a one-cell layer lining in our small intestine with just billions of folds that if I pulled it out and ironed it out in a healthy individual, it would cover 2 tennis courts. When that barrier system gets compromised, when it breaks down, which I'll be going over why that would happen, that is the gateway to immune dysfunction and autoimmunity. Some of the scientific literature says that one cannot have an autoimmune disease without developing leaky gut or increased intestinal permeability. So this is not a new concept, folks. This has been in the scientific literature for 100 years. We've known about this for over 100 years, so it's a real thing, it's a real entity. There's ways of testing for it, and there's ways of correcting it. And again, functional medicine, which is what we do in our clinic, we are very interested in that, whereas traditional medicine isn't really interested in the underlying causes. They just want to manage your symptoms with different pharmaceuticals. Even the father of medicine, Hippocrates, said all disease begins in the gut, and that is certainly true with autoimmune disease. I don't care what type of autoimmune disease presents to my clinic, the first thing we're going to do is look at this. Now, what would cause our guts to become too permeable? Food sensitivities. Folks, the food we're eating today is very different. It's been genetically modified, it's been deaminated, the gluten molecule has been deaminated. It looks very different chemically than it did 20, 30, 40 years ago. So what happens is we eat these things, and our immune systems in our gut, which we inherited from our great-great-grandparents, it takes generations to change the DNA and genetic coding of our immune system. It looks at these foods and says, you know, this food is foreign, this chemical is foreign, and it starts to attack it. That is a huge thing that happens, which will create inflammation not only in the gut, but in the body and the brain. But this will be a cause of a leaky gut syndrome. It'll cause the gut barrier to break down. High sugar diet. The standard American diet is ridiculously high in sugar. Alcohol is a huge toxic chemical to our gut barrier. Stress and hormones, especially the stress hormone cortisol. So we measure our patients for high cortisol levels, and if they're high, that's going to break down gut barrier in addition to causing your thyroid function to not be so good. Hidden infections. Many of my patients don't produce enough acids in their stomach, so they get like GERD and reflux. And the reason why the acids are there is to kill germs that we all eat every day. We all are exposed to these different germs. If we don't have sufficient acid production in our stomachs, then that's going to create an environment where infections can take root, and that is a reason for leaky gut syndrome. Small intestinal bacterial overgrowth. This is I'm going to be doing several slides on this. This is a situation where certain bacteria that normally reside in our small intestine flourish. They become too plentiful, too much, and then they over-ferment our carbs and our fiber when we eat. They produce different gases like methane gas and hydrogen gases, causing constipation, diarrhea. And this also will cause the gut barrier to break down. And we talked about poor stomach acid and poor vagus nerve function. I'll be doing a whole separate video on that. The innervation from the brain, the autonomic function from the lower brainstem into the gut is carried by a very important nerve called the vagus nerve. And this nerve controls blood flow to the gut. And when that nerve isn't working very well, you're going to have symptoms like snoring and poor gagging or excessive gagging, bloating, and poor acid production. And so that can be a major cause of leaky gut syndrome. Now, leaky gut syndrome is also related to other immune dysfunction. Remember, when the gut barrier becomes too permeable, that is the gateway to immune dysfunction, whether it's autoimmune or things like allergies, asthma, autistic children, any neurodevelopmental delays could be tied to leaky gut, eczema and psoriasis. When we have inflammation in the gut, we're going to get inflammation in other immune areas like the skin and sinus membranes. and inflammatory bowel disease like ulcerative colitis, Crohn's, and celiac disease. Now, some of the symptoms that we're going to see with leaky gut syndrome are food sensitivities, because we eat the foods, now the gut's too permeable, and larger than normal molecules make their way into the immune system, and it starts to form antibodies to the food, and then every time we eat it thereafter, we cause an immune response or an inflammatory response. Leaky gut leads to autoimmunity in the gut itself and in the body. The three main autoimmune diseases in the gut are ulcerative colitis, Crohn's disease, and celiac disease. So if one is suffering with those three gastrointestinal autoimmune diseases, I guarantee that they're going to have leaky gut, and we can fix that. We can identify it and fix it. Autoimmune disease, we talked about that. Thyroid issues, malabsorption and fatigue. People who have leaky gut aren't absorbing their nutrients. There's too much inflammation going on, so they'll have things like diarrhea and constipation, which impedes absorption. So fatigue is always a byproduct of malabsorption, and the fatigue usually hits the brain. So we'll see like brain fog, memory loss, depression, anxiety, things like that. Inflammatory skin conditions like acne, rosacea, and eczema. Folks, many people out there suffering with skin conditions, and they're all tied to the gut. And then we talked about how leaky gut affects brain. Mood issues, depression, anxiety, ADD, ADHD, all of these neurological disorders or neurodevelopmental delays that we see in the children, many of them have leaky gut as one of the culprits behind why they're suffering from it. The main point I want you to understand this whole conversation today is leaky gut can be tested for and it can be repaired. We use a lab called Cyrix Lab. You can go to their website, cyrixlab.com. They even have a really nice video on leaky gut and how it affects the brain and leads to brain autoimmunity. You can go there and watch that. I'm Dr. Ed Beyer. Hope that helps. Have a great day.